Heart disease and its related illnesses are a major problem. One of the best places in the country to receive medical care is here in the Mid-South. Baptist Memorial Hospital DeSoto recently received a top ranking in cardiology care from a national organization. Dr. ARIE of the Stern Cardiovascular Foundation and Director of Cardiovascular Services at Baptist Memorial Hospital DeSoto joins us now with details in today's Heart of the Matter. Doctor, thanks for joining us today.
Hello, Joe.
We understand that HealthGrades has ranked Baptist DeSoto #1 for cardiology services in all of Mississippi. What does this ranking mean?
We've been ranked by HealthGrades as the #1 hospital for cardiovascular services in all of Mississippi. We were given a 5-star ranking. What that means is that if you were to come to our hospital, a 5-star hospital, you would have a 73% greater likelihood of surviving a cardiac problem over the national average. And if you were to come to our hospital, you would have a 63% less likely chance of having a complication if you were here for a cardiovascular procedure than the national average. And those are pretty impressive figures. If you were to take all 5-star hospitals, and that probably encompasses about 10% of the hospitals in this country, and if everybody went to those hospitals, between the years 2008 and 2010, about 240,000 lives would be saved, and there would be approximately 164,000 fewer complications if all hospitals were ranked 5-star.
What is HealthGrades, and how did it develop the ranking system?
So HealthGrades is a U.S. company that was founded in 1998, and what they basically do is they rate hospitals, doctors, dentists, nursing homes based on their quality and safety. They compile their data mostly through Medicare claim data, and they look through millions and millions of records. They then analyze the data, and then they, through a specific methodology, they apply a ranking to the hospital based on a 1-star, which is suboptimal, a 3-star, which is considered average, and 5-star, which is considered above average, for 26 separate procedures and diagnoses. So this is, really, they look at the facts. It's not just who's the most popular. They actually look at data, safety data, outcomes data. They analyze it, and they apply it and rate a hospital.
How did Baptist DeSoto achieve this rating?
Well, this all started a couple years ago when the hospital, the staff, the physicians came together and felt that they wanted to make improvements in their outcomes. This was a complete collaborative effort, and it couldn't be done without the efforts of every single person who's involved. We started looking at our heart attack data. How good are we at getting people from the emergency room to the cardiac catheterization table? How quickly do we do it? When we do it, how are outcomes after we've opened up an artery? And as you know, or heart muscle and saving heart muscle is all based on how quickly you get to the patient and how well you do your procedure. And this takes individuals throughout the entire process. So this was a complete collaborative effort. As part of that, we also applied for accreditation through the Society of Chest Pain Center, and this is a rigorous evaluation that we had to go through to prove that we meet standards and quality for managing chest pain above what is expected to be the national standard.
What is Baptist DeSoto's plan for the future? How do they plan to build on this achievement?
Well, we're really excited about the ranking. We were proud to get that. We're going to continue to work together as a team, because the only way that this came to life was doctors working together, the staff, the administration, and we're going to continue working together to achieve the goal, our ultimate goal of reducing the incidence and prevalence of heart disease in this community and improving the health of the community. In the short term, what we're doing is we're analyzing the HealthGrades data, and we want to know where our shortcomings are. How can we improve in certain areas? There are also 26 procedures and diagnoses that they looked at, some of which we didn't receive high rankings. We want to know why, and we want to address those issues and improve upon that. Also in the short term, we plan to develop a valve clinic, a heart failure clinic, a women's prevention and treatment of heart disease center, a prevention program. We have just merged two cardiology groups in the area, both Memphis Heart and Stern, and collectively with Baptist, we're going to collaborate on different projects that ultimately will lead to an improvement in the outcomes, safety, quality of the care we deliver.
Dr. ARIE SZATKOWSKI, thank you very much for joining us here on Heart of the Matter.
Thanks very much, Joe. Appreciate you having me here.